So welcome to the 2024 Small Grant Announcement, the Small Research Grant Announcement. I am Sue Haddock, Sigma Foundation for Nursing Board Chair, and on behalf of the board, I thank you for your donations and for joining us today. Your donations to the Foundation's Research Permanent Fund make possible the grants that are awarded annually to nurse researchers around the world. We received more than 100 grant applications from 5 global regions for last December's research grants deadline, and we will be funding 15 small grants to researchers in 2 global regions this June. Today, we have recipients with us to give you an overview of their studies that will be conducted over the coming year. I am pleased to first introduce to you Dr. Chelsea Howland of the University of Iowa in the United States, who will give us an overview of the study, Engaging Rural Adults with Type 2 Diabetes in Adaptation of a Physical Activity Intervention for a Mobile App. Dr. Howland?
Thank you, Dr. Haddock, for the introduction. I am deeply grateful to have received this funding, and I'm very excited for the opportunity to represent Sigma. The study Engaging Rural Adults with Type 2 Diabetes in Adaptation of a Physical Activity Intervention for a Mobile App is a mixed methods design study, and I seek to explore preferences for and understanding of graphically presented physical activity data in rural people aged 40 and older living with Type 2 diabetes, as well as to adapt a physical activity intervention for a mobile app delivery platform. To explore the preferences for and understanding of graphically presented physical activity data, we're going to survey a group of participants. It's really critical for us to understand how people understand their health information in the context of a mobile app. And this is really to help us ensure that the visualizations or the graphics that we use to show people their data can be used to make meaningful decisions about their health. To do this, participants will complete surveys that have various graphic presentations, and we're going to look at this information in relation to their age, their numeracy skills or how they use numbers in their day-to-day life, graph literacy or how well they understand graphs, as well as their digital literacy or how will they interact with things like mobile apps. For the second aim, the physical activity intervention will be adapted for the mobile app platform through 3 iterative cycles of think aloud sessions and cognitive interviews. I developed and evaluated the physical activity intervention called Active for Life during my dissertation work in collaboration with rural community stakeholders. Active for Life emphasizes activities to develop behavioral intention and support enactment of new behaviors. And it includes content tailored for the unique barriers to living a physically active lifestyle inherent of the rural built environment. Active for Life is being adapted to an existing mobile app platform that was developed with rural stakeholder input specifically to address care access gaps experienced by people living in small towns and rural areas. Upon completion of this study, the expected outcome I have is to have developed a mobile app intervention for people with type 2 diabetes living in rural communities. And it's going to support me pilot testing the intervention with a larger sample. Engaging with people who live in rural communities who are managing complex, high burden chronic diseases is going to help to improve our ability to identify effective approaches for health promotion and ultimately reduce disparities in care. Thank you.
Thank you, Dr. Howland. Joining us next is Dr. Ming Li of Hong Kong Polytechnic University in Hong Kong. She will tell us about the study, Effects of a Mindfulness-Based Physical Exercise Program for Community-Dwelling Older Adults with Sarcopenia, a randomized controlled trial. Dr. Li?
Good morning, everyone. Thank you so much for supporting our research, and I will briefly introduce it. Imagine that, please remember that, do you have a moment when you can't open a can? Well, this happens frequently in all adults who have sarcopenia. Sarcopenia is an age-related muscle disorder. We know that when we are getting older and older, we will lose our muscle, we will become less capable in our daily lives. The situation is much worse in all adults who have sarcopenia. They can't open a bottle, they can't stand up from a chair without any help, let alone live by themselves. physical exercise is highly effective to help them to improve their physical function and enhance their ability in daily life. However, this population, their motivation to exercise is very low. For example, we all know that the benefits of physical exercise, but we can't keep a regular exercise habit. We can't keep a regular physical exercise. And in addition to the characteristics of this population, such as decreased physical function, accessibility, they also have many misunderstandings towards exercise. For example, they think they are too old to do any exercise even before they trying. And in those who did try to do some exercise, they have some negative thoughts, emotions. For example, they feel fatigue, breathless, or anxious and frustrated when they can't perform a certain movement. These factors not only further undermine their motivation to exercise, but also undermine their psychological well-being. Mindfulness is designed for improving psychological well-being. And when we do meditation or other mindful practice, we will fully focus on the present moment. We will disentangle with our negative thoughts, and we will truly feel our sensations. That means mindfulness can help us improve our experience and perceptions of what we are doing. And therefore, our research is incorporate mindfulness into a traditional physical exercise to improve the exercise experience and adherence of this population, and also their psychological well-being. This study is a random controlled trial, and it is based on our previous research. Actually, in my previous research, we did a pilot RCT, and based on the feedbacks of our participants, this program is further improved to provide better support and benefits for them. And by conducting this program, we hope to have this population to do their daily activities and facilitate their healthy aging. And that's all. Thank you. Thank you so much for supporting our research.
Thank you, Dr. Lee. This is very interesting. So next on our list of grant recipients is Dr. Sonique Salzman of Georgia Baptist College of Nursing, Mercer University in the United States, whose study is Perspectives in Latino Adolescents, Cultural Beliefs and Practices about Health Literacy. Dr. Salzman.
Good morning, everyone, and thank you for this generous donation towards this study. So the purpose of my study is to explore the cultural beliefs and practices of Latino adolescents in the city of Atlanta. It's related to the acquisition and utilization of health information. Although there is growing research regarding health literacy specific to adolescents, there's limited data available that illuminates aspects of health literacy in Latino adolescents. So available studies focus on testing interventions to improve health literacy, but fall short of providing an understanding of how specific cultural groups acquire and use health information. So this study aims to seek culturally specific information from Latino adolescents, which can ultimately lead to increasing the healthcare providers' understanding of how cultural beliefs concerning health literacy influence cultural practices. So the approach will be through an ethnographic qualitative approach in focus groups. And the hope is, to further this into larger groups and getting more information. Thank you so much for your time.
Well, thank you, Dr. Salzman. So the last grant recipient with us today is Elaine Sang of the University of Pennsylvania in the United States. Her study is examining the relationship between sepsis survivor education quality, self-care knowledge, self-care, self-efficacy, and 30-day rehospitalizations. So Dr. Sang.
Hi, I'm not a doctor yet. I'm just a PhD student, but thank you. Thank you so much for this opportunity and for supporting my research. Um, so my patient population of focus is sepsis survivors, and in the worldwide, more than 14 million patients each year are diagnosed with sepsis, and due to advances in hospital treatment and clinical guidelines, many of them, around 11 million, in fact, will be discharged as sepsis survivors. However, many sepsis survivors do have long-term morbidity and mortality, which has not exactly been explored yet. And many of these sepsis survivors also have long-term symptoms, which could last up to 5 years, and they are collectively known as post-sepsis syndrome. However, despite all of this, sepsis survivors are critical and have been understudied, and there are many opportunities to improve health outcomes. And this is especially important given that sepsis survivors are around twice as likely to be rehospitalized within 30 days with sepsis, and many of these hospitalizations could have been prevented. There is a Surviving Sepsis campaign, which is an initiative by the European Society of Intensive Critical Care Medicine and the Society of Critical Care Medicine, which provided a recommendation for sepsis survivors to be offered education on sepsis, as well as post-sepsis syndrome, and as well as sepsis and post-sepsis treatment. However, many studies on providing sepsis survivors with education are limited, and those that have done so have shown that the quality of the education has been inadequate and unsatisfactory. My study is in my study, my approach is to do a qualitative study interviewing 20 sepsis survivors, as well as 20 people from 20 home health nurses, as many of these sepsis survivors do go on to home post-acute care, such as home health, to really understand in detail what sepsis survivors know about sepsis, about post-sepsis syndrome, as well as how home health nurses deliver the education. And I also plan to collect information about their self-care, self-efficacy through using surveys, as well as following them longitudinally to see about whether they are rehospitalized within 30 days. So thank you again for this amazing opportunity.
So thank you, Elaine. And you see, I was anticipating your successful completion of your PhD.
Thank you.
Okay, so if any of our participants have questions for the grant recipients, please put them in the chat. And while you do that, I am pleased to introduce Sigma President, Dr. Sandra Bibb.
Thank you so much, Sue. I appreciate having this opportunity to congratulate these grant recipients. And first of all, I want to say huge congrats on achieving these grants. I understand personally how important small grants are to the progression of a research program, and I commend your persistence and your dedication to finding the answers that you're looking for. I also want to thank our foundation donors for investing in the future of healthcare, the future of nursing, through their very, very generous donations. These grants would not be possible without that generosity. And it's exciting to see that we have some of our foundation donors on, as well as members of our international board of directors. I want to just take the liberty with a few minutes to talk to each of you about how excited I am about your individual pursuits. You might want to ask yourself a question and say, how can you be excited about all of our pursuits? Because they all relate to improving health outcomes, but more importantly, they relate to specific interests that I have that relate to areas that I have been involved with. If I were to start, first of all, with you, Dr. Howland, I would say mixed methods is a love of mine. And I celebrate anybody who's walking down that road. But I'm also excited about this intervention that involves a mobile app, because for me, access to care, and that's what you're looking at, improving access to care as well as improving population health, is something that is widely needed. So I commend you and I congratulate you. As I move to Dr. Lely, first of all, I want to congratulate you for joining us from Hong Kong and being here as we celebrate you. And I want to mention that your idea of mindfulness and an exercise for community dwelling older adults with sarcopenia is very exciting to me, because your expressed interest in promoting well-being. So congratulations on that pursuit. Dr. Salzman, now I have to say, I'm not biased, but cultural beliefs and practices are something that I live every day. And I had an opportunity working with doctoral students a few years ago to explore health literacy and how important it is and all of the influences. So your topic really does resonate with me because of your interest in increasing health provider understanding of the impact on health beliefs, so that we can actually focus on understanding health from the perspective of the individuals that we're delivering healthcare to. And then I want to talk about this sepsis piece, because I had the honor of being a research director for perioperative clinical nurse specialist for almost 10 years. And I got to hear and learn a lot about rehospitalizations and how important self-care knowledge and self-care efficacy is. So I applaud you on this pursuit. But what's more important, I enjoy listening to your careful identification of the gap in the literature, and then finding the place that you're going to fit. Because as the research director and as an educator of doctoral faculty, that was always the key thing. What does the literature say, and what is that gap? And I mentioned that specifically to you because you pointed out to us that you're still a doctoral student. But here's the thing: you've seen the light because you're past the qualifying, and you're like, somebody released you to go ahead and do your dissertation work. So double congratulations to you. Again, I want to thank all of our donors for being here with us today. I want to thank the members of the board of directors that are here. And I will end my comments by saying, huge congrats to all of you. Way to represent. Thank you, Sue.
Well, thank you, Sandra. This has been a good opportunity to make those research programs that they are proposing even more meaningful to each of us who are on the call today. We do have a few questions, and so we'll go forward with those. The first one is for Dr. Howland. I think the first two, so maybe I'll just combine those. How do you work around the lack of internet access in rural areas, And then can you describe your proposed app in a bit more detail, how you will develop and test it, and what you anticipate in terms of education needed for those who use the app? So a rather detailed, lengthy question, but have at it, please.
Absolutely. So first, talking about lack of access in rural areas. So I will absolutely acknowledge there is a difference, a disparity in terms of broadband internet access between urban and rural areas. That gap is closing, but that's actually why I chose to go with a mobile app. So we know that people who have a lower income, live in more rural areas, and are of more diverse backgrounds have a greater access to health information using mobile apps than relying primarily on broadband internet access. And that's because they can use cellular data plans as well as broadband internet access for that. So that's one method. Additionally, just considering, I think studies like this are really needed to help drive policy forward so that we can see greater improvements in terms of internet access in rural areas. And I hope that addressed the first one. To address the second one, a little bit more about the app in detail. So the app is building on an app platform that was developed by one of my co-investigators. And the app itself, my intervention, uses the health action process approach model as a theoretical framework to guide behavior change. It starts by developing behavioral intention and then moves into an action planning or a volitional phase, and then finally moves into kind of a self-regulation, self-monitoring type phase. So the app itself is a platform for delivering the intervention. It has a few different tiles. I wish I could pull it up. It has a few different tiles, though. It'll have a library, and that's going to have content in it. There will be content that both guides people through the intervention, so kind of through the behavior change techniques and the active intervention components that I want to make change. But then there will also be information about physical activity behavior change, about different strategies for behavior change, so that people can really identify a personalized goal. This framework relies on using a SMART goal, but to really create an individualized plan that works for each person, and then they're able to self-monitor and track their goals within the app as well. There's also areas where people have kind of a journal where they can personally reflect on things that they might not want to share with their peers. There's also going to be an area for group discussion where people in the intervention can share peer-to-peer to get some of that social support and peer interaction. And then there's also a feature for nurse messaging. So that's where a research nurse will have the opportunity to reach out directly to the participants, or participants can reach out to them. The intention isn't to replace medical care with that aspect, but it's to have kind of a hands-on touch with a nurse during the intervention. In terms of education needed for those who use the app, so I think it's really important for interventions like this to have strong training in terms of interventions, thinking about intervention fidelity. In the beginning, ensuring that I've structured in education so people know how to use the app, they know the intention of using the app, and they're able to use it thoroughly, but then also providing education about diabetes in general, diabetes related to being more physically active, because the spectrum can range widely in terms of some people may, have primarily diet and activity that they use to manage their diabetes, whereas other people may be taking several medications that could be heavily influenced by increasing their activity levels. Also education about different types of physical activity. So everything from aerobic activity with walking, resistance training, balance training, and flexibility. Education surrounding behavior change techniques. So those are a few areas that I think education will be particularly impactful in the app. And how will I develop and test it? So the content was previously developed and evaluated. And then this study is actually going to be what's starting to test it. So we're going to move the content into the app and do some usability cycles to look at usability and acceptance. And then a next stage for me will be to actually pilot the app as a randomized controlled trial.
Thank you. Okay. So now this question isn't for anyone specific, unless it might be for you, but perhaps each of you could talk about how you plan to publish your research. Dr. Holland, do you want to start?
I can start, yeah, live off mute. So plans for publication, I think I would be interested first in disseminating in general through poster presentations and podium presentations, most likely regionally initially, and then looking at potentially National Rural Health Association, or I've done some work with American Heart Association. They have a nice subgroup for diabetes management. And then in terms of actual publication, I think I have opportunities to go a technology route, potentially, or a rural route. So the Journal of Rural Health, I think, would be a great fit, or potentially there's several different journals surrounding technology and usability are options I'm looking at.
Okay, thank you. Dr. Lee, how do you plan to publish?
Okay. Oh, well, I think there are several ways to share our results, our families. First, we will share our families in some international conference, such as some conference in geriatric nursing or public health. And the second one, I think we will publish our papers in journals. And our aim is the top one journal in nursing studies, the International Journal of Nursing Studies, and also other geriatric, or the geriatric nursings or other public health or community health. And third, we will share our findings with our participants and other healthcare professionals in the community care, and we will share this intervention into details with them and see whether they can adopt this intervention in their daily work. Yeah.
Okay, Dr. Salzman?
Very similar, but you know, pathways as far as, you know, starting slow. And so slow, I mean, in from a granular to more large. So starting with it with my fellow nursing academic faculty. I love to share faculty meetings. I think that's a great place to start. And then, you know, going further out and submitting abstracts for podium presentations, but then going another further, as some would say, to connecting with the World Health Organization, the CDC, and then also with children's healthcare systems, right? And talking with them about patient education approaches that are not so broad, that do include cultural aspects and are open to, you know, what is out there, what has been studied, what do we know works and doesn't work, because, you know, everywhere is so diverse now. You have patients from all over the world, and we need to know how they approach healthcare and health literacy. And so if my population is Latino adolescents, then I need to speak to the children's healthcare systems and, you know, speak with them about how they engage in patient education.
Okay, thank you. And Elaine?
Hi, my approach would be similar to everyone else who has answered. So what I first plan on doing in terms of disseminating my research is submitting abstracts for posters as well as podium. Potential conference venues include the Academy Health conference that's typically held in June every year, as well as GSA, which is the Gerontological Society of America, as sepsis survivors are commonly older, about 65 years or older. And then after being able to present my research through conferences, I hope to disseminate it through publication, potential publication venues. Not venues, potential publication journals include the Patient Education and Counseling Journal, as well as the Journal of Nursing Scholarship. But I'm also open to consider others as well. And same
Okay.
for other conferences.
All right, thank you. So now there's a question here about theoretical or conceptual frameworks and were they used in any of the studies? Bandura's self-efficacy may have been used in one, but did the others of you use conceptual frameworks or theoretical frameworks in your studies?
You can go, Elaine.
Oh, so I think the Bandura self-efficacy may have been the one for me in terms of the question. The although that is partially true, the other conceptual framework that I used for overall as self-efficacy is just one part, although important. my conceptual framework is the transitions theory by Melise. And it focuses on the transition of sepsis survivors from hospital to home. Of course, given that my population is sepsis survivors and the setting is at home health, I'm more focused on the at the end of the transition. And so that is this conceptual framework that I'm using. The conceptual framework does include a couple of constructs, such as the nature of the transition, which defines what the transition is. Also transition conditions, such as social determinants of health, as well as culture and so forth. And also patterns of response is their knowledge on sepsis, on post-sepsis syndrome, as well as how to care for themselves after surviving sepsis. And nursing therapeutics is another construct which is focused on the education that has been received and that will continue to be received through home health.
Okay, lots involved in that study. Dr. Salzman?
My mouse is fighting me. So I utilized, and this was, a lot easier to put this together, is the framework for studying adolescents' health literacy, right? But I am adding in the component of the Latino adolescents. So this framework was developed by an author by the name of Manganiello. And this framework targets three main concepts. And there are individual traits, interpersonal influences, and systemic contributors to health literacy. So, a child isn't born, or a person isn't born just knowing things, right? Or knowing healthcare information. There are influences to that. There are varied types of health literacy, and health literacy directly impacts health outcomes. So, unlike a lot of other theoretical and conceptual frameworks, it takes a little bit of trying to figure out how I'm going to make this connect. This one is pretty straightforward, and I'm grateful for that. And then the Latino adolescent part is the cultural aspect.
Okay, great. And Dr. Lee?
Okay, yeah, because my intuition is to combine mindfulness and exercise. Yeah, so sure, yes, we have a conceptual framework to get us how to combine those two components and how our intuitions is linked to our outcomes. Actually, our conceptual framework is based on two theories. One is the primal theory of motivation. This theory explains several factors how we can how do we understand motivation and how we can improve it. It's very detailed, and we can follow this theory step by step, and including the not only the physical aspects but also the emotional and the response part. And the other theory in our conceptual framework is the mindful coping module, because we need to use mindfulness. So we need to understand how mindfulness can improve the motivation. Because by doing mindfulness, we can focus on our present moment. We can keep away from our negative thoughts, and this is very important points in the primal theory of motivation. And by combining these two theories, our conceptual framework is to improve not only the physical health but also the psychological health of this population. Yeah.
Thank you. And Dr. Howland?
Yeah, thank you. So I previously mentioned the framework used for the intervention, but for this study, since it's focused on adapting the intervention to a mobile app framework and looking at understanding, we use the Health Information Technology Acceptance Model. So this is a model borrowed from person-centered design, and it has concepts that look at the influences of the understanding of health information, as well as concepts surrounding usability and acceptance. So we're really looking at how usable is the app, how acceptable is the app, to ensure that we have adequate fidelity when moving forward in testing.
Okay, thank you. So there's another question here about, this is for for Elaine, and if you can briefly tell us how you think your work could affect the homeless population.
So although I guess one limitation of my study is that I am interviewing sepsis survivors who are in home health. However, with that said, the homeless population typically overall in general do have worse health outcomes. So with that said, if the education that if patients or sepsis survivors in home health report that their education is not great or ideal, and they also have the resource of home health, that does potentially imply, of course, more research needs to be done on this, but it could potentially imply about the home health I mean, not the home health, the homeless population or sepsis survivors who are homeless may have even worse outcomes, or even worse or even less understanding in terms of sepsis and post-sepsis syndrome, which could lead to future studies focused on this particular and unique population.
Okay, thank you. I thank our 2024 research recipients again for joining us, and wish them well and continued success throughout their career. I also thank the foundation donors on the call and ask that you please continue to donate annually so important nursing research like this can be supported. And please share what you heard today with your colleagues and encourage them to donate to nursing research at Sigma Foundation. There are a number of opportunities coming up, International Nursing Day. Please consider these times as great opportunities to contribute to support our research going forward. So if there's nothing else that anyone wants to say at this point, okay, then we're good. And again, thank you for joining us today. And thank you, recipients, and good luck with your research as you go forward.